Hello, this is Dr. David Trumbore from Elite Personal Training and Fitness Solutions, and today I'm excited to talk to you about why you should be exercising. And perhaps another way of thinking about this is we're going to be discussing what the health benefits of exercise are. But before we get started, I want to give you a little background about myself. I graduated from Temple University in Philadelphia in 1983 with my degree in physical therapy, and then graduated from Widener University with my doctoral degree in physical therapy in 2005. Additionally, I hold some very high-end and important certifications. I am a certified strength and conditioning instructor, I'm a certified weight trainer, and a certified Pilates instructor. So for the last 37 years, I have been rehabilitating and treating patients and training fitness clients. Also, I've gained an expertise in the science of weight loss and weight management and have created and taught a course, Why You're Not Losing Weight. So, if you're watching this video, you're obviously interested in exercise in some measure and probably know that it's a good thing. But I want to expand our thought today by making this statement. Exercise is by far the single most important thing that you can do to improve your health. And I think that by the end of this video, you probably will agree. Now, I want to give one asterisk before I get started. I'm not talking about just carrying a box or two up to your attic or walking to your driveway to get your mail. That is exercise, and you are moving around, which is better than sitting around. But I'm talking about regular and routine exercise, preferably prescribed, and exercise, particularly resistive training. So let's start with the most obvious one that probably most people know, and that is exercise makes your muscles stronger. This is really important because muscles don't grow and get stronger on their own. You don't just sit around and go, wow, I got jacked up. It doesn't happen that way. You have to challenge your muscles in a healthy way, and you need to exercise regularly for that to happen. And that's important because the stronger you are, the better your body will function, and the less likely you will be to get injured. And it kind of works like this. If the most you can pick up is 30 pounds, that's your max, and you go to Home Depot for a gardening project, and you pick up a 30-pound bag of mulch or rocks, well, you're already maxed out, and the likelihood of injury is significant. But let's say you can pick up 75 pounds easily. Well, that 35-pound bag of mulch now is well within your tolerance, and the likelihood of getting injured is very low. So it helps you function better and limits injury. It's also significant because there's something that happens which is dreadful as you age, and that is, one, muscle cells atrophy, which means they wither away and they shrink and get smaller. But even worse, they die off. There's a process called sarcopenia. Now, you don't need to remember that big word, but sarcopenia means cells, muscle cells in particular, literally die as you age. And they're gone. Once they're gone for good. This particularly happens in your 50s at an alarming rate, and it's the reason why you could look at someone at 50 and then 70 and say they now look like an old man or an old woman. I don't mean because they have gray hair or their skin has changed, but their lean muscle mass has withered away. In fact, so much so you might see an older person walking with a walker or a cane because they don't have enough bodily muscular strength to even carry their frame around walking, and they need support. Strengthening exercises also improve your bone health. Exercise is the best intervention for osteoporosis and its precursor, osteopenia. Osteoporosis is when the bone mineral content leaches out and the bone becomes brittle and you're susceptible to fracture. And exercise is the best strategy because it keeps the bone mineral content positioned in the bone and it makes it much stronger. And this is huge because the statistics on falls and fractures are staggering. In the United States, people over 65, 1 out of 4 will fall every year. Every 11 seconds, someone over 65 falls, and staggeringly, every 19 minutes, an elderly person who falls and breaks a bone dies of the consequences of it. So the difference between falling and having a bruise and getting up versus falling and having a fracture and surgery and all the devastating consequences is enormous. Exercise is huge. Exercise is the best strategy for weight loss, not dieting. Now, I know almost everyone thinks, okay, I want to look better for the beach. I want to drop 10 pounds to get in my wedding dress or a dress for a prom or something like that. And you think, I need to go on a diet. This video is not about this topic in particular, but we could talk about this for hours, and you can check out our video library because there'll be more information on this. But diet is not the best strategy. One, you tend to go on some extreme diet. It doesn't teach you proper eating. It doesn't change behavior. When you go back to eating, you go back to eating your normal way and you gain the weight back, but you usually gain even more so back. And that's because when you reduce your caloric intake, your body doesn't know what's going. It thinks it's going to be starved, so it slows down the metabolism to be efficient. And then when you gain all the weight back, you now have a slower metabolism. Exercise does the exact opposite. Exercise ramps up and speeds up your metabolism, which is obviously a good thing for burning calories. So you burn calories not just when you exercise, but at rest because your metabolism is ramped up. Probably most importantly, exercise is the best strategy for losing belly fat. And we have other videos, particularly on this topic, because it's so important, but I want to touch on it just a little bit here and discuss it briefly. There's two types of fat in the body. The fat that accumulates on your arms, your back, your butt, your hips, your legs, that's called SCAT, subcutaneous adipose tissue. Adipose means fat cells, and subcutaneous means it's below the skin. Now, this fat isn't good by any means. It's unsightly, it adds stress to your heart, it adds stress to your joints, but it is not nearly as devastating as belly fat. Belly fat has its own name. It's called VAT, visceral adipose tissue. Visceral means it refers to your organs, your stomach, your kidney, your spleen, and this is the fat that accumulates around there. Now, you can check out other videos, particularly on this, but the significant thing to know is this belly fat functions as an endocrine gland. Endocrine glands are things like your pancreas, your thyroid, your adrenal gland, and they secrete hormones, and that regulates how your body functions. Well, this visceral fat, this belly fat, functions like an endocrine gland, but everything it does is destructive. It secretes inflammatory proteins that cause all sorts of inflammation. Everything it does is terrible. It drives high cholesterol levels, it drives high lipid levels, it drives prediabetes, diabetes, insulin resistance, it drives coronary artery disease, high blood pressure, any of the metabolic disorders that are behavior driven and modifiable. It is the culprit behind it. In fact, you can make this correlation. The more belly fat you have, the more sick and more disease you'll have. And if you reduce that, you can reduce the disease processes. The significance is the best strategy for reducing belly fat is exercise. And as you reduce belly fat, you then reduce disease process. So the remarkable thing is you can have disease. You can be diagnosed with hypertension. Your blood pressure is too high. But you can reduce belly fat and no longer be hypertensive. You can have blood pressures that are no longer deranged. And you can be diabetic. And you can reduce belly fat and get your blood sugars into a healthy range. The best strategy, not the only strategy, but by far the best strategy for addressing this, the best intervention for belly fat reduction is exercise. Exercise also reduces the force through your joint. Muscles have two kind of basic functions. One, they move your joints, and two, they protect it. So I weigh 210 pounds. When I take a step, 210 pounds has to go somewhere. The stronger my muscles are, the more they will protect my knee and my hip and my ankle joints, and the weaker and less flexible they are, the more force is going to go through those joints. Therefore, exercise is the best intervention for arthritis, for both preventing arthritis and managing current symptoms. And check out our other video about arthritis and how personal training can help. Exercise also improves sleep. Not just that it tires you out and therefore you fall asleep better, although that's true, but it also helps to regulate the hormones that trigger that whole process. Sleep is a complex process. It starts becoming nighttime. Your body starts realizing it's time to wind down. It's getting dark. Your body releases melatonin. That triggers all sorts of other things to help your body go to sleep, and exercise is a very important part of that. Exercise is really important for gut health too, and it improves it. And gut health is significant. It's not just the digestion of food, though it does do that, but the more research that comes out and the more time goes on, the more we see the gut is related to so many things. Gut regulates appetite. So in order to have a normal process of your brain being told, hungry, time to eat, okay, you ate, time to shut off, that balance is regulated by the gut. The immune system is regulated by the gut primarily. We used to think it was elsewhere, but now we know the gut is a major controller of how your immune system is. If you have gut problems, You can have something called leaky gut syndrome. We have a whole other video on that about why you should be taking probiotics and leaky gut. If this is where you're at in life, exercise helps fertility. For men, exercise raises testosterone levels. It improves sperm production and sperm motility. And if you're a woman, it helps to regulate and improve ovulation. Exercise improves self-esteem. Obviously, if you look in the mirror and you don't like what you see, it affects your self-confidence and your self-esteem. When you look better, you tend to feel better and be more confident, and it's good for your overall mental health. And finally, the 10th thing I want to discuss, and there's certainly many more, but I wanted to leave it to 10, is that exercise is excellent for cognitive or brain impairments. You may have seen in the media or Google or things that you may read, come across in the news, that exercise is being prescribed as one of the major significant interventions for things like Alzheimer's and dementia. Now, it might be hard to make the connection because when you exercise a muscle, you do 3 sets of 10 and you understand the connection, they get stronger. But it's not exactly like you do 3 sets of 10 for your brain, so how does that work? Well, it has to do with insulin resistance. And I want to just discuss this for a minute because this cognitive improvement from exercise is very significant. The way things normally work is the fuel that cells use, whether they're brain cells or muscle cells or nerve cells, is glucose. Glucose is sugar broken down into its simple and usable form, and every tissue in the body uses glucose. So when you eat, your body breaks down the fats and carbohydrates and calories into a usable form, glucose. But glucose can't transport itself by itself. It needs an Uber lift. And that Uber lift to carry it around is insulin. So as your blood sugar goes up, your pancreas notices it. It secretes insulin, and insulin picks up the glucose for a ride. And then insulin drives it to the tissues. But insulin can't drop it off by itself. It needs to load into what's called a receptor. Think of a ship going into a loading dock. Once the insulin goes into the receptor, the loading dock, it drops off the glucose. The cells are happy, they have their fuel. Your brain is happy, it has its fuel, and everything functions well. Well, when you have something called insulin resistance, there is impairment or dysfunction of this receptor site. There's difficulty for the boat to dock. And therefore, insulin can't drop off the glucose, and therefore the tissues don't function well, whether that's nerve tissue or eye tissue or brain tissue or muscle tissue. So the things that cause insulin resistance are things like high-fat diets, high-sugar diets, lack of exercise, visceral body fat, smoking, bad sleep. Notice all those are very modifiable. So what happens is your brain develops insulin resistance. Insulin can't drop off the glucose. The brain doesn't function well. And then it drives things like anxiety and depression and bipolar disease. It may not necessarily cause those, but it can exacerbate them and make them worse. And it causes other cognitive impairments, such as Alzheimer's, Parkinson's, dementia. In fact, we now believe that 3 out of 4 cases of dementia and Alzheimer's disease are driven by insulin resistance. The significance here is, if you've been following all this, insulin resistance, bad, causes brain to not function well, causes brain cognitive impairments. So you'd think, well, what do you do to get rid of insulin resistance or reduce it? The number one strategy for doing that is exercise. Exercise is the most significant intervention to reduce insulin resistance, which allows glucose to get to the brain better or the other tissues, and you function better. So those are 10 significant reasons why you should be exercising, and to establish that exercise is the most significant thing that you could be doing to improve your health. But before I end this video, I want to address what's obvious. If you're watching this, you're interested in exercise in some measure, and therefore you probably have exercised. But you probably found that pathway to be frustrating and full of failure and confusion. In fact, 90% of people who start an exercise program will stop after 3 to 6 months, and there's lots of reasons. Injury, you don't know what to do, it hasn't been prescribed for you, it hasn't been effective, you make some progress at first, and then it becomes stagnant. There's all sorts of reasons to stop, and most people do. 1 out of 10 continue on their own, and 90% of people stop. So this video is part of really a 3-part series. This one is why you should be exercising. I want to encourage you to watch the second video of this series, which is why you should have a personal trainer to help you. And then finally, the third video, which would be why you would pick Elite Personal Training and Fitness Solutions as your personal trainer. So I want to encourage you to watch those other videos. And I want to end on this note. We want to help you to succeed in exercising. I want to encourage you to check out our website. And what we do is we allow you to come in for a free consultation. We can sit and talk and discuss your needs and your goals. We then evaluate you, check out your past medical history, medicines you might be taking, injuries you may or may not have, supplements you may or may not be taking. We do an evaluation from an orthopedic musculoskeletal standpoint. We do a fitness evaluation, and from that, we can prescribe, monitor, progress, and hold your exercise program accountable. So once you go to our website, check us out, and I want you to remember this. If you won't invest time, energy, and money in wellness, you'll soon and eventually need to invest more time and energy and money in illness.